technique. Let's begin today's technical briefing. Over to you, Dr. Njoo.
Okay, thank you very much. Merci, Eric. Good afternoon. Thank you for joining us at this technical briefing on the COVID-19 vaccine rollout in Canada. With me once again are Major General Dany Fortin, Vice President of Logistics and Operations at the Public Health Agency of Canada, Dr. Tom Wong, the Chief Medical Officer of Public Health of Indigenous Services Canada, and Ms. Ariane Reza, the Assistant Deputy Minister at Public Services and Procurement Canada. We will each deliver brief opening remarks and then open the floor to you. As of today, just over 1 million doses of COVID-19 vaccines have been administered in Canada, of which over 870,000 individuals have received at least one dose, and more than 113,000 have received 2 doses. As we prepare to vaccinate more and more people in the coming months, we want to provide everyone in Canada with the information they need to make an informed decision about vaccination when a COVID-19 vaccine becomes available to them. Earlier this week, the Government of Canada announced new funding through the Immunization Partnership Fund to support the work of our partners across the country to help increase vaccination confidence and uptake. This funding aims to increase Canadians' understanding and awareness of the importance of vaccination and to deliver tools to help increase vaccination coverage. This includes specialized training for healthcare providers to communicate with patients, as well as tailored local initiatives. We have seen the importance and success of community-led approaches, such as the one that we announced recently with Anishinaabe Aski Nation in Northern Ontario. Active engagement with community partners and leaders is critical to increase vaccine confidence and subsequently uptake. We will continue to work together to build on these and other COVID-19 public education projects in collaboration with our provincial, territorial, and community-based partners throughout Canada. Bonjour à toutes et à tous. Merci de vous joindre à nous à cette séance.
Dr. Njoo still speaking. Good afternoon and thank you for joining us. Once again, with me are Major General Dany Fortin, Vice President of Logistics and Operations at the Public Health Agency of Canada, Dr. Tom Wong, Chief Medical Officer of Public Health from Indigenous Services Canada, and Ariane Reza, ADM, Public Services and Procurement Canada. We will each deliver brief opening remarks and then open the floor to you. As of today, just over 1 million doses of the vaccine have been administered in Canada, of which 870,000 have received at least one dose, and more than 113,000 have received 2 doses. As we prepare to vaccinate more and more people in the coming months, we want to provide everyone in Canada with the information they need to make an informed decision about vaccination when a COVID-19 vaccine becomes available to them. Earlier this week, the Government of Canada announced new funding through the Immunization Partnership Fund to support the work of our partners across the country to help increase vaccination confidence and uptake. This funding aims to increase Canadians' understanding and awareness of the importance of vaccination and to develop tools to increase vaccination coverage. This includes specialized training for healthcare providers to communicate with patients, as well as tailored local initiatives. We have seen the importance and success of community-led approaches, such as the one announced recently with the Anishinaabe Aski Nation in Northern Ontario. Active engagement with community partners and leaders is critical to increase vaccine confidence and subsequently uptake. We will continue to work with our partners on this and other COVID-19 public education projects in Canada in collaboration with our provincial, territorial, and community-based partners. I will now ask Major General Fortin to say a few words, followed by Dr. Wong. Thank you.
Merci beaucoup, Dr. Njoo. So good afternoon, everyone. To date, we have distributed 1,185,000,000 vaccines to provinces and territories. This week, Canada received and distributed 79,000 doses of Pfizer-BioNTech to provinces. We expect to distribute approximately 70,000 doses next week. And Pfizer has indicated they will be scaling up shipments starting in February to meet their target of 4 million doses by the end of March. To that end, they're forecasting shipments of at least 335,000 doses the week of February 15th and 395,000 the last week of February. Now, Moderna continues to ship on a 3-week schedule. 180,000 doses of Moderna arrived this morning in Canada from Europe and will be distributed over the next few days. Moderna takes a bit longer to get to all destinations, as you will appreciate that many of those designated vaccine delivery sites are in the far north and in a remote isolated communities in the country. We expect to have another Moderna shipment the week of February 22nd, with the remaining doses to round out their commitment for the first quarter of 2 million doses. We're working with the manufacturer to confirm the upcoming shipments in February and into March. Now, this is a long game, and as we discussed before, the ramp-up planning is ongoing. Phase 2 of the vaccine rollout, the ramp-up, will see a significant increase in vaccine supply across Canada. We're expecting 20 million doses of authorized vaccines to be available in the April to June timeframe, and we'll see even more as other vaccine candidates get Health Canada regulatory approval and become available. The Vaccine Rollout National Operations Center continues to work with the planning estimates and confirmed allocations received by the manufacturers. In addition, we continually share updates to provinces and territories to enable them to make informed decisions about their immunization plans. Merci et bon après-midi. Nous avons distribué à ce jour 1 185 000 doses de vaccins aux provinces et aux territoires. Cette semaine, le Canada a reçu une livraison de 79 000 doses du vaccin Pfizer-BioNTech et les a distribuées aux provinces. Nous nous attendons à distribuer environ 70 000 doses la semaine prochaine. Pfizer a indiqué qu'elle augmenterait le volume de ses envois à compter de la fin février pour atteindre le nombre visé de 4 millions de doses d'ici la fin mars. Pfizer prévoit, pour y parvenir, un volume d'expédition d'au moins 335 000 doses la semaine du 15 février et 395 000 doses la semaine suivante, fin février. Moderna continue d'effectuer ses envois aux 3 semaines. Actuellement, 180 000 doses du vaccin de Moderna sont arrivées ce matin au Canada, de l'Europe, et la distribution aura lieu au cours de la semaine qui vient. Les envois de Moderna prennent un peu plus de temps à arriver à leur destination, car bon nombre des sites de vaccins sont situés, désignés par les provinces et territoires, sont situés dans le Grand Nord, ainsi que dans les régions éloignées et isolées du Canada. Nous attendons donc à une autre livraison du vaccin de Moderna au cours de la semaine du 22 février. Le reste des doses nécessaires pour que le Moderna respecte son engagement d'ici la fin de ce trimestre est de 2 millions de doses et ce sera attendu entre fin février et mars. Nous travaillons avec le fabricant pour confirmer les envois à venir. Maintenant, c'est un plan à long terme, le programme de distribution. Il y aura, au cours de la phase 2 de déploiement des vaccins, qu'on appelle aussi la phase d'accélération, une importante augmentation de l'approvisionnement en vaccins. Nous nous attendons à ce que 20 millions de doses de vaccins autorisés soient disponibles au cours de la période d'avril à juin, le deuxième trimestre. Et ajouté à ça, s'ajouteront d'autres candidats vaccins qui demeurent, qui sont toujours en attente de l'autorisation réglementaire de Santé Canada. De plus, le Centre national des opérations ici à l'agence continue de travailler les estimations prévisionnelles, les allocations confirmées qui lui sont fournies par les fabricants. En outre, nous communiquons continuellement les mises à jour aux provinces et aux territoires. Nous allons continuer de le faire pour leur permettre de prendre des décisions éclairées dans leur programme, dans leur plan d'immunisation. Je vous remercie.
Merci beaucoup, Major General. First of all, I want to acknowledge that I'm on the unceded territory of the Algonquin people. Although we are starting to see a reduction of First Nations on reserve active cases by more than 50% since last week. Marginalized urban Indigenous peoples continue to experience precarious conditions, including systemic racism, food insecurity, and access barriers to care. As vaccine rollout continues, it remains critical that First Nations, Inuit, and Métis partners across all settings are included at decision-making tables and continue to engage in co-planning to determine ongoing capacity and needs within communities. Currently, there is a national, federal, provincial, territorial, and Indigenous vaccine working group established, and we continue to encourage facilitating similar co-planning tables in each region. It is essential that the Indigenous peoples remain a priority as provinces and territories begin co-planning for future phases of the vaccine rollout. Through the trilateral discussion tables that have been established with Indigenous partners, the Government of Canada and the provinces and territories will keep working closely together to support the development of a clear and transparent process regarding the next phase of the vaccine rollout. Il est essentiel que les autochtones demeurent la priorité.
Dr. Wong, continuing to speak. It is essential to have planning for the next stages with the provinces and territories. The Government of Canada and the provinces, as well as the territories, will continue work at the trilateral planning tables and will continue to work in close cooperation together to support the development of a process that is transparent and which will serve for the second phase of the vaccine rollout.
Merci et thank you.
Thank you, Dr. Wong. Merci, Dr. Wong. We will now open the phone line to questions. Please identify yourself and include the media outlet you're representing. We'll be taking your questions in both official languages. Veuillez vous nommer et nous dire quel média vous représentez. Nous demandons de limiter à une question et seulement une question suivie. Et vous pouvez poser votre question dans l'une des deux langues officielles. Donc, nous commençons la période de questions.
We'll now begin the question period.
Thank you. Please press star 1 if you have a question. Appuyez sur étoile 1 pour poser une question. Our first question is from Mia Robson from the Canadian Press. Please go ahead. À vous la parole.
Hi, good afternoon. I think this question might be for Major General Fortin. I'm wondering, with AstraZeneca likely to be approved soon, when we will know what the delivery schedules are of that? Do we expect any doses from AstraZeneca coming in the first quarter at all? And if so, when will we learn how many and where they're going to go? And the same question for the others. When will we learn what delivery schedules for Johnson & Johnson and Novavax?
So I'll start and I'll ask my colleagues, Dr. Njoo and Mrs. Reza, to add on additional vaccines. What I can tell you is that we are planning a number of contingencies. We have made projections available to provinces with regards to what we expect to see in terms of additional quantities and additional vaccine candidates in the second quarter. So we have developed a number of scenarios and projections of numbers and quantities over time, and we'll continue to work to that end with the provinces and help them help each other out in terms of identifying the equipment that we need, the health human resources required to scale up significantly as we get at least 20 million vaccines in the next quarter. Let me turn over to Dr. Njoo, please.
Okay, well, thank you very much, Major General Fortin. What I can add is that from the public health perspective, we've been having very good active discussions with our counterparts, the chief medical officers of health in all the provinces and territories in anticipation of having the AstraZeneca vaccine approved. Obviously, we're waiting for a decision from Health Canada. As well, we're also working closely. We're anticipating that the National Advisory Committee on Immunization, they're also going through the data and their deliberations to give us their best advice for the use of the AstraZeneca vaccine. I think at this point, what I would say is that recognizing that we would have a suite of vaccines as we've talked about before, we have 2 approved vaccines and we anticipate maybe AstraZeneca and others also coming on board. We need to look at what might be the best sort of use of the individual vaccines as part of an overall vaccine approach in Canada, because obviously each of the vaccines has a slightly different profile. Everyone can look at the clinical trial data and see that, okay, maybe it might be more effective maybe in a certain demographic group and so on. So those are lots of different factors to look at. And certainly at the end of the day, those are part of the deliberations from a public health perspective that will obviously be useful to the provinces and territories. And then that would also in turn relate to the logistics in terms of delivering the vaccines to our colleagues in the provinces and territories. So I'll leave it at that. Thank you.
Thank you, Dr. Njoo. Just a quick reminder for our speaker to put themselves on mute when they're not speaking. On that, we'll take a follow-up. Mia.
Sorry, I don't think I heard whether or not you answered if we're expecting any doses beyond Moderna and Pfizer in the first quarter, including AstraZeneca. But I'm also wondering, maybe Dr. Njoo, this is a question for you. There have been concerns raised about AstraZeneca in a few other countries about seniors and whether there was enough data for seniors. So is that one of the things that's being taken into account, whether or not it should be used in that kind of population? And do you have any concerns about that particular vaccine and seniors?
Well, I can't really speak for our Health Canada colleagues. Obviously, the regulators, are independent at Health Canada, and they're receiving the data and information from the company in order to make a sort of their assessment and deliberations in terms of what would be important from an approval perspective, and that would also, I think, reflect in terms of maybe the indications for that vaccine. I think all of us, myself, I've seen some of the quote data reported in the media, but that's not the same thing as having sort of the very detailed data that Health Canada colleagues would obviously be sort of in receipt of and looking at very closely right now.
Thank you very much. Opérateur, prochaine question.
Thank you. Notre prochaine question nous vient de Hélène Buzetti du Devoir.
The next question is from Le Devoir.
Oui, bonjour. Je sais pas qui
Good afternoon.
La question, mais
I don't know who will answer the question, but I would like to clarify the COVAX situation. Could you tell us how many vaccinations will come through under that system, when, and why did we feel the need to exercise our right under that program?
Bonjour, c'est Ariane Reza de Travaux publics. Je peux commencer à
Asian Reza from Public Works speaking.
Pour noter que l'annonce des doses du vaccin AstraZeneca, on anticipe recevoir
we anticipate receiving 1.9 million doses
entre maintenant jusqu'à vraiment la date
between
de juin.
Now and June.
Le nombre de doses qui sont le minimum qu'on peut
This will be the minimum number of doses.
Et on a accès à ces doses
and the interpreter will point out that the sound quality is making interpretation exceptionally difficult. Interpretation will resume when the sound quality improves.
Merci. Hélène, question suivie?
Ben oui, alors vous dites c'est un minimum anticipé. Est-ce qu'il y a un
secondary question, follow-up. The vaccine hasn't even yet been approved in Canada, so I assume that this means that we won't be receiving the doses until the approval is granted. If it is, if it were to go beyond to June, would those doses be postponed to the fall then?
Okay, here we see la dose, c'est-à-dire que c'est
Answer.
le volume minimum. On travaille toujours avec COVAX parce que, comme vous pouvez voir, la chaîne de
Ms. Reza, we
globale
continue
est
to
très
work with
fragile.
COVAX. The
Et
chain,
c'est,
distribution chain is
chiffre conservateur qui nous ont
fragile.
donné. Alors, c'est une base pour commencer et ça pourrait être augmenté pendant l'année. C'est ce qu'on
We have a
attend, mais on n'est
base.
pas encore à 100%
The numbers
sûr
will
parce qu'on
increase.
travaille toujours avec les fonctionnaires.
We continue to work with officials.
de ceux qui traitent de la question de l'approbation réglementaire. Bien sûr, on attend pour voir
We are
les
waiting
résultats de ce processus. Merci.
for additional information. Thank you.
Merci beaucoup. Operator, next question.
Thank you. Our next question is from Mackenzie Gray from CTV. Please go ahead. À vous la parole.
Hi there. My question's for Major General Fortin. In slides that were circulated to the provinces with your name on it, you said, quote, the week of February 22nd will also be impacted, referring to the Moderna shipments, and Moderna has not confirmed allocations of that week. It's my understanding that we were expecting 230,000 doses on that week. Can you confirm, Mr. Fortin, that there will be less than that number coming in during that week?
So we initially were expecting 230,000 doses of Moderna this week. And Moderna indicated last week that we would receive 180,000 doses for a number of reasons. So those doses have arrived, and they will be distributed starting tomorrow. As for February 22nd, we are originally expected a slightly higher number, around 249,000, and that number is the quantities that we expect to receive remain to be confirmed by the manufacturer. So at this time, I can't really tell you what the quantity will be, but we do not expect to receive 249,000 at this time.
Has Moderna given you any explanation as to why we are expecting less? We understand with Pfizer that they're retooling the facility and they've given us a reason why. But do we know why with Moderna that we're receiving less than we were promised?
Well, I think Moderna has indicated that they are in good faith trying their best to provide as many doses as possible, as fairly and as equitably to their market and this global demand. So they haven't shared the specifics of challenges that they may experience in their yields or in their production, but they remain committed to providing us 2 million doses by the end of March, and they're working to that end very closely. So we're in very close coordination with them, and we expect to receive very soon a confirmation of what we expect to receive on the third week of February. And that is why those numbers are not currently shared with provinces. We just don't know what those numbers are for certain. So we're not going to circulate information until we have actionable information for provinces and territories to work with.
Thank you, Major General Fortin. Operator, next question. Prochaine question.
Thank you. Our next question, notre prochaine question est de Catherine Lévesque de la presse canadienne.
Our next question is from La Presse canadienne.
Oui, bonjour à vous tous. J'aimerais poursuivre par
Good
la lancée de
afternoon,
mon collègue
everyone.
de
I'd like to follow along the same line of question. General Fortin, did you try to find out why Moderna reduced deliveries? Is it because of problems? What is the reason? Have you determined the reason? Answer from General Fortin. Moderna has not mentioned production problems as such or problems at the plant. Moderna is facing a growing demand. There are global challenges for production. Production and quantities were reduced. We're not sure what we will be receiving on the third week of February, but there is no indication there is a major problem. We continue to assume that we will be receiving the quantities as discussed. I think it's important to reiterate, once again, as I've said since December, that we are in a period where quantities are limited. It's deliberate. We are working with what we have, with the quantities we have. Everyone knows at all levels what they need to do. Everyone is facing pressure from all sides with respect to accelerated production as well. Thank you. Next question.
J'aimerais maintenant revenir sur COVAX.
The journalist. I'd like to go back to COVAX. We're supposed to be receiving between 2 and 3 million doses.
dans l'atteinte de nos objectifs de vaccination.
Are those doses necessary for us to achieve our objectives once AstraZeneca has been approved, for example? So that's my question. Do we really need the other doses here in Canada? General Fortin speaking. Allow me to start by saying that we've always talked about 6 million doses in the first quarter, 20 in the second quarter, and some 45 million doses in the third quarter. Of the 80
des deux manufacturiers approuvés présentement pour distribution au Canada, Pfizer et Moderna.
From the companies that have been approved, Pfizer and Moderna, 80 million doses. The bulk will be coming in September. We expect to be in a position to provide a vaccine to all Canadians who want to receive one by then. Now, as I said, the vaccine quantities are currently limited. Many colleagues and ministers on several occasions have said we are attempting to receive as many doses as we can to continue with the vaccination, and that is why there is the potential addition of COVAX.
Oui, c'est aussi Dr. Njoo. Peut-être je peux ajouter quelques mots.
Dr. Njoo speaking. I'd like to add some comments. To date, we have 2 vaccines approved, Pfizer and Moderna. If we look from a public health perspective, it's always better to have a broader selection of vaccines. That gives us greater flexibility to operationalize our vaccine rollout. If we have a broader range of vaccines, more doses. Health Canada will be making a decision on AstraZeneca. At present, we are working in close cooperation with our provincial and territorial counterparts. And we're looking at data. They will be providing recommendations if there is another vaccine approved, in addition to AstraZeneca. The more choice we have for vaccine, the more doses available, the more we will have to provide to the provinces and territories. Thank you.
Dr. Njoo. Operator, next question.
Thank you. Our next question is from Marie-Kay Walsh from the Globe and Mail. Please go ahead. À vous la parole.
Good afternoon. Thanks so much for taking my question. I'm wondering if any of you at the table, whether it's Ms. Reza or Dr. Njoo or Major General Fortin, can explain what the federal government's understanding is of how reliably the 6 doses of vaccine can be withdrawn from one Pfizer vial with this low dead space syringe, and also when the first shipments from the federal government will go to the provinces of that low dead space syringe.
I'm not sure who wants to start. maybe I'll start from sort of the technical sort of public health perspective. As we've indicated earlier, the company Pfizer has put in a submission to Health Canada because the official approved product monograph indicates that per vial, there are 5 doses that can be extracted in sort of a regular and consistent manner. Now the company, it's up to them in essence to provide the data and information so that Health Canada, in terms of its analysis, is comfortable that the product monograph could or should be changed because you can, in a consistent and regular manner, draw 6 doses per vial. To that end, we also recognize that there are 2 aspects in terms of being able to do that. One, of course, is the equipment, obviously with a specialized syringe, a low dead space volume syringe that will sort of minimize, or at least compared to the ordinary syringe, the amount of sort of maybe wastage in terms of a residual volume left in the syringe of any liquid extracted from the vial. And of course, there's also the human factor in terms of making sure that the vaccinators have the appropriate training and experience to be able to also reliably draw the vaccine doses from the vial. But at the end of the day, right now, it's really up to the company to provide the relevant data and information to Health Canada so that they can do their analysis with respect to that consistent and regular sort of withdrawing of be it 5 or 6 doses per vial. Thank you.
Thank you. Follow up?
I would.
Go ahead, Major General Fortin.
Thank you. I was only going to say we're working very closely with provinces and territories, particularly with the Pfizer case here, working with provinces on ensuring we have good visibility on stock on hand, what type of syringes and what quantities and where. Meanwhile, Canada's procuring additional syringes, and without getting into Ms. Reza's space, Minister Anand, you will recall 2 days ago, indicated that we have contracted millions of the low dead space syringe, specialized syringe for this type of activity. So a combination of receiving equipment, some of which is on the way, distributing that to provinces, additional training to ensure that we optimize the ability of the clinicians to actually administer the 6 doses out of the vial is all underway. And once the regulatory approval is modified for 6 doses, the quantities would be adjusted.
Thank you, Major General Fortin. Margaret, follow up?
Yeah, sorry. So can you just say clearly yes or no, Dr. Njoo? Are you saying that the federal government doesn't right now know how reliably this 6 dose can be pulled? Because from your answer, it seems like you don't have the information. And to Major General Fortin, can you please tell us when those low dead space syringes will actually be shipped to the provinces? Because as we've reported on Ontario, for example, some health authorities are calling veterinary clinics trying to find a syringe specialized enough.
Okay, so maybe I'll answer the first part, Marika. It's not a question of what we know or don't know in the federal government. I think the onus really is on Pfizer, the manufacturer, because certainly with the initial submission and what the approved monograph indicates is that you get 5 doses out of a vial. And in terms of it being a liquid, there's always what we call a required overfill, so that that there's a bit of excess volume per vial. And so now, if the company wants to put forward a submission to indicate that yes, you can reliably and consistently draw 6 doses out of a vial, taking into account the overfill that's also required under the regulatory regime, it's up to them to furnish the appropriate data and information so that Health Canada can do their assessment and then either indicate yes, no, that we're comfortable, yes, we could or should be changing the product monograph. So it's really a matter of the information data that Pfizer provides to Health Canada.
Thanks. And can Major General Fortin just clarify when the syringes will be sent?
So a portion of the nearly 40 million syringes that Canada has bought are underway. They should arrive in the coming couple of days, so 2 million or so. And then they'll undergo testing and will be distributed shortly thereafter. So by the end of next week or into the following week, so I'd say by February 15th, according to our estimation, we'll be in a position to distribute across the country those initial syringes. Additional syringe will arrive in February, March onwards. So we're in a good position in that regards. Additional contracts are being pursued, and Ms. Reza could amplify if required. But that's the intent here, to buy as many of those as possible to immunize for immunizers to work with the proper tools.
Thank you, Major General Fortin. Operator, next question. Prochaine question.
Merci. Notre prochaine question est de Laurence Martin de Radio-Canada.
The next question is from Radio-Canada. The journalist. Yes, good afternoon. My question is for Major General Fortin. You said that Moderna didn't give us a reason for the delivery reductions. How do you know that you're going to be receiving 2 million doses by the end of March then? You've said that we're facing limited quantities. There must be a great demand worldwide. So how can we be sure that Moderna will be giving us what they promised to give us?
Bon, effectivement, il n'y a aucun moyen
Answer.
d'être certain.
General Dany Fortin, there's no reason to doubt that they won't, but Moderna clearly is facing global demand issues. It's a new product, it's new technology, it's different from other vaccines as well that have been produced in the past. So those are very real factors that manufacturers have to deal with. That's the first point. Secondly, we continue to ensure that production is going well. Distribution is as fair as possible. With Moderna, we can achieve our objective for the first quarter. There isn't a ravine that we need to cross. We will continue to move forward. We continue to be looking to the 20 million doses starting in April, with once there are other vaccine candidates approved. It is disappointing to see this obstacle, but it is temporary. All indicators show that production is going well. I can't obviously go and verify myself, but we do have indicators showing that production is going smoothly. So there is no reason to think that we will not meet our production objectives. Follow-up question by the journalist. Under COVAX, how many additional people do you think you'll be vaccinating, or do you plan to vaccinate by the end of March? General Fortin, if we get between 1 and 3 million doses, it's 2 doses per person. When we start to receive them, based on the calendar or the timeline and rollout established with the provinces and territories, we will be able to add that to the vaccine rollout in those areas. And based on the timeline, we will be able to maximize the use of vaccines. AstraZeneca has fewer logistic challenges surrounding it because of the temperatures, so we believe that we will be able to move it quickly to the provinces and territories. Additional question by the journalist. Can you give us a number by the end of March? Major General. 2 million divided by 2, 1 million. 1 million people could be vaccinated with that. Ariane Reza speaking, and the interpreter is unable to hear Madame Reza adequately. Interpretation will resume when the sound quality improves.
On ne sait pas encore les détails des livraisons, on ne sait pas bien sûr l'approbation des règlements. Alors, je pense qu'on ne peut pas vous donner un chiffre de Canadiens qui peuvent être inoculés. Merci.
Merci beaucoup, opérateur. Prochaine question.
Thank you. Our next question is from Abigail Beeman from Global News. Please go ahead, à vous la parole.
Hi there. Thanks for taking my question. Provinces say that it's very hard to plan for the specifics of their vaccine rollouts when they have no information at all about what's coming in March. I heard you say, Major General, that you just don't know, and that's what you can't tell them. But what do you say to these provinces that are struggling to plan for this, especially with the 2 doses needed?
Well, that's correct. The best way the best way that we can plan in the short term, the best way to help provinces and territories to plan in the short term is to provide them visibility on what they expect to receive and when. At this time, we're able to share what we know in terms of Pfizer doses. We're receiving indications of what we expect to receive in March. We're still processing this information, and we'll be in the first week of March, and we'll be soon able to share that with provinces in confidence so that they can plan accordingly. We do not have visibility at this time on the next shipments of Moderna product. So that is a real limitation in the short term. Completely understand that it's making it more difficult for provinces to prepare clinics and prepare the vaccine distribution sites.
Thank you. Follow up?
Yeah, I'm wondering if you can tell me if you are at all worried or how much you're worried that March's shipments would be at all threatened by the EU's export controls?
I will ask my colleague, Ms. Breza, to answer this more fully, but I think we have had very positive answers to date, and we've been able to receive our shipments as planned this week.
Yes, just to add that, as indicated and as announced, the Prime Minister has spoken to his counterpart. Senior officials on the Canadian side have been working very closely with the EU to make sure that we are as compliant as possible. We continue to work with Moderna and Pfizer. As Major General Fortin just indicated, we have had no issues with this week's shipment. The information is posted on a EU website, and we continue to be as compliant as possible and is planning to be able to get the shipments moving as quickly and seamlessly as possible. Thank you.
Thank you. Our following question is from David Thornton from CBC News. Please go ahead. À vous la parole.
Hi, everyone. Thanks for taking our questions. I'm just wondering if you can maybe tell us where you'll be targeting the AstraZeneca vaccine, because it's easier to ship, easier to store.
Maybe I can start answering this question and then ask my colleague, Dr. Njoo, because there's other aspects of advice that come into play. But we are currently planning projections to provinces and territories of additional vaccines should they become available, in the first quarter, and we've shared that, and we continue to drill down as to what that would mean. As you would expect, we are looking at all contingencies, mitigations, and really factoring in how we distribute additional vaccines as they become available, based on a series of assumptions. So if they become available in March, what does that look like? If only in April, what does that look like? So those are the kinds of multiple scenarios that we're investigating.
Yep. So, Dr. Njoo, I can add to that. I think, as Major General Fortin has indicated, the logistical requirements for the AstraZeneca vaccine are much easier to manage than, compared to the first two vaccines, the mRNA vaccines. And therefore, I think in terms of the vaccination programs in the provinces and territories, it'd be much easier because in many ways it will be similar to the type of infrastructure that would be used to deliver other types of vaccines, for example, the influenza vaccine. So just something to keep in mind. However, as I indicated earlier, we're also looking forward to the recommendations for the National Advisory Committee on Immunization, as well as, of course, our regulatory colleagues. Those two groups are looking very closely at the clinical trial data and other information that will be and has been provided, I understand, by the company in order to make their determination, certainly from Health Canada, from a regulatory approval perspective, and then for the National Advisory Committee on Immunization to look at how that particular vaccine would be best used to its advantage in sort of, I think, in many ways in conjunction with the other two already approved vaccines. And so with those recommendations, which we anticipate would be coming fairly shortly, I think then the provinces and territories at the Special Advisory Committee, we'd have further discussion because at the end of the day, each province and territory would have to look at how best to use this additional vaccine in terms of their sort of suite of tools of vaccines along with the other two already approved vaccines. Obviously, based on the data, there might be a different target groups or populations in which it may be used compared to what we're now using with the mRNA vaccines. Thanks.
Thank you. Follow up, David?
Yes, thank you. I just want to circle back to a question that was asked by my colleague from the Canadian Press. Can you give us any more information? Can you tell us what are the working numbers that you're giving to the provinces for Q1 for the distribution of the AstraZeneca vaccine?
So at this time, we have not given we have not given quantities of AstraZeneca vaccines per se to provinces and territories. We're still working the different scenarios. What we have provided is ranges of options. So into the second quarter, the approved vaccines up to 20 million, broken down over the 3 months, what that looks like. As additional vaccines become available, you have a number of scenarios. They're not per vaccine, but if additional vaccines that we might expect to come online, available and approved in that period, the quantities might reflect a range of scenarios. So we topped up a certain quantity, broken down per capita to all provinces, and then we have a range of quantities to work with. So as we confirm or deny the approval or availability of one or more vaccines, those numbers change. But at least we have a range of expected quantities or potential quantities for provinces to work with, and therefore look at how they can redistribute cold chain enabling equipment, line up the health human resource required to build capacity over time. So that there's a number of assumptions still being made and confirmation to
what's that range
for our planning.
And what's that range?
We said one question, one follow-up, so we'll move on to the next question. Operator, next question.
Thank you. Our next question is from Jacques Galland from the Toronto Star. Please go ahead, à vous la parole.
Hi, Major General Fortin, can you say how quickly Canada could start receiving the AstraZeneca doses once it's approved by Health Canada?
Well, I think there's a number of variables at play, but one thing for sure is that it is far easier to immunize with a cold 2 to 8 degree vaccine than a frozen or ultra low temperature vaccine. So the distribution becomes easier. Provinces and territories could leverage existing mechanisms, clinics, pharmacies, pharmacy networks, and so provinces would be able to put that in gear in a short order. Because we would be speculating as to when they would arrive, I'm not really able to right now to commit as to how much time it would require for provinces to be ready. But from different discussions, we have not received any indications from those provinces and territories that would be a problem. Necessarily, as we get a little bit more clarity, we'll engage with provinces and develop those different scenarios and have a clearer answer to that.
Thank you. Follow up.
And then we also heard then that we'd be getting 1.9 million doses then anytime. I think it was between now and June if the vaccine's approved by Health Canada. But we also heard this morning that a suggestion was made to AstraZeneca about manufacturing the vaccine here, which AstraZeneca was not interested in. If Canada was able to manufacture the vaccine here, what kind of impact would that have on vaccine rollout? Is it fair to say we'd be able to access even more than 1.9 million doses between now and June if we could manufacture it here?
I can't comment to this, but I can ask Ms. Reza if she could amplify.
Thank you. I would say that that would not be something that would be doable between now and June, as supply would come online from domestic production. It could be added to the number of firm doses we bought through the APAs. Thank you.
Thank you very much. Operator, next question.
Thank you. Our last question is from Brian Platt from the National Post. Please go ahead, à vous la parole.
Hi, I wanted to ask a question about rapid testing, so I'm not sure who the best person is to answer. But from what I've seen from the latest numbers, the federal government's now distributed about 15 million rapid tests, something along those lines. But if we want to use rapid testing for weekly screening or ideally twice weekly screening at every long-term care home, large workplace, and school, 15 million tests actually doesn't get us very far nationally. So, I understand one problem here is resistance from provinces to actually use these tests, but do we have the ability to scale up supply if we start using them widely?
It's Dr. Njoo. I can speak to the indications for use for the rapid testing, and I'll leave it to my colleagues, maybe Ms. Reza, to speak to sort of the acquisition of the rapid testing kits. When we talk about rapid testing, I think it's important to distinguish there are two types of rapid tests or closer point of care tests. One is a molecular or PCR test, which we all sort of appreciate as sort of the gold standard, or at least sort of the most accurate test generally. And there's also what we call the antigen test. I think most people, when we're talking about rapid testing, I think are referring more to the antigen test. And as we've indicated at previous press conferences, that so the reliability of the results is probably not to the same degree as the so-called molecular or PCR test. Our laboratory colleagues and other experts throughout the country have looked at the data and evidence to further clarify or give their best recommendations as to how these tests could be or should be used, obviously also in conjunction with the PCR molecular test. So what I would say is that, as you indicated, yes, certainly there is a place for it in an overall testing strategy. Certainly in long-term care facilities, regular screening and testing of, let's say, staff, residents, also in various workplace settings, I think it can be used to a very good advantage. And then I guess based on the test results, certainly if there's a positive result, how best do you verify it with a molecular test? That there are guidance that's out there for I think sort of a consideration by the provinces and territories. So I think overall, as you said, the resistance, if you can call it that, I think the provinces and territories, as they become more comfortable with the antigen test, I think they're using it more and more. I'm certainly aware that, for example, in many provinces and territories, they're using it on a more expanded basis in long-term care facilities, which is, I think, very important as part of an overall proactive approach to protect the staff and residents in those facilities. And I think also, as you've probably seen, there's also various initiatives to sort of have that more widely used in the work setting. I think many major companies are also being part of various pilot projects to use the type of testing technology to sort of look at how it can best improve the sort of the safety of their employees, but also maintain business continuity in their settings. So I think I'll leave it at that. And with respect to the supply issue, I'll turn to my colleagues. Thank you.
Thank you, Brian. Go ahead, Ariane.
Just to quickly note, as the incoming question indicated, we have a supply here in Canada, and we continue to work very hard to secure more supply. We haven't encountered rate-limiting supply issues, but we continue to actively monitor the rapid test supply to ensure that as it's rolled out federally to PTs, that there is no supply constraints in the future. So it's actively monitored. Thank you.
Thank you, Brian. Follow-up?
Yeah, can I, just on that last point, I don't think I fully understood. Did you say you have had some rate-limiting issues? I didn't fully understand on the procurement side what your answer was there. So could you please clarify?
Apologies, I was probably speaking too rapidly. To say that we have not encountered rate-limiting constraints, and that we continue to actively seek to bring in supply as quickly as possible across the different types of testing kits that our client is looking, the Public Health Agency is asking us to procure. Thank you.
Thank you. Operator, next question.
So we have no further questions registered at this time. Back to you, Mr. Morissette.
Well, thank you very much. C'est ce qui met fin au briefage technique pour aujourd'hui. That will be all for today's technical briefing. Thank you very much. Have a good afternoon. Bonne journée.
Thank you. Merci. La conférence est maintenant terminée. Veuillez s'il vous plaît raccrocher votre ligne et merci.